If you want to learn about healthcare in southeastern North Carolina, Carolina People will bring it to you. Coming up next. Good morning. Welcome to Carolina People. Today we're in Lumberton, North Carolina. We're at the Robeson County Fairgrounds, and we're focused on the healthcare providers here in Robeson County. We're visiting with the Director of Public Relations for the Southeastern Regional Medical Center, Ann Stevens. Ann, thanks so much for being with us this morning.
It's good to be here. Thank you for inviting me.
The opportunity to spotlight Robeson County this week, out here at the Robeson County Fairground with the 56th annual fair, to hear some of the highlights going on at the fair, and so much with economic development in the county. Yesterday we talked with not only a local farmer, Bowstone, but folks with the service and the Department of Agriculture that help make sure that Robeson County's agricultural strength keeps going in the direction that we pray it'll keep going. Surely the healthcare providers in the county have been a magnificent force bringing the community together. I think we also talked earlier to someone from the Southeastern Regional Medical Center, Morris Bullock, who's been with you, it sounded like 15 years. How long have you been at the center, Ann?
I've been there since 1981.
Okay.
Yes, and we are growing. There has not been a single year that I've been there that there was not at least one construction project underway. So the medical center has continued to grow, and we are in a big growth phase right now, as a matter of fact.
Tell me about that a little bit. Primarily at the medical center or throughout the county? Well,
at the medical center, we are the major healthcare provider for the entire county and some of the surrounding counties. So we offer comprehensive health care through our hospital and its affiliated organizations. Right now, we are in the final stages of a master facility plan that we developed about 3 years ago to bring all our facilities up to date and make them more user-friendly for our entire population. We have just completed a doubling in the size of our emergency services, and we take care of about 60,000 emergency patients every year. That's a lot of people.
60,000?
Yes, we're in the top 10 in the state. Even kind of the big major medical centers, we are usually come in at 6 or 7 in the number of emergency patients we take care of each year. So that was a definite need to upgrade that space and make it more efficient. We've also just opened a major renovation and expansion of our Gibson Cancer Center, a comprehensive outpatient cancer center that gives both radiation and chemotherapy for people who have been diagnosed with cancer.
And your main responsibility as the Director of Public Relations, obviously you've done a great job getting the word out about the medical center. Are there on a day-to-day basis, or are there activities within the medical center that you're particularly involved?
Yes, my main responsibility is getting the hospital story out to our various publics within the county. And I do this through our local newspapers, TV stations, getting those news releases out to them. We publish also a community health magazine 4 times a year that's direct mail to our people in the community called HealthWise. We have an internal newsletter called In Touch that goes out to our community, and through a lot of different avenues we get the story out.
Speaking about getting the story out, Ann, real quick about yourself. Are you a Robeson County native? I think you said you've been at the hospital or the medical center since '81. Have you been in Robeson County your whole life?
No, I haven't. I was originally from High Point, and I'm a native North Carolinian.
Yes.
But arrived here in Robeson County in 1981.
Did the opportunity at the medical center, excuse me, not to cut you off, is that what brought you to the county?
Actually, I came here with my husband with a job opportunity for him, and I was able to also get connected with the medical center, and it's interesting we've lived all over the country and all over the South, but we've been here in Robeson County longer than any other place, so we call it home.
And it sure is. I can see that in the face of so many folks that have been on this week and will be on later this week. Any primary medical services that the medical center provides? I know oftentimes a medical facility is well known for a certain aspect, and you talked about some affiliated organizations earlier that are associated with the regional medical center. Is there a primary focus that of expertise here at the Southeastern Regional Medical Center?
Well, yes. In addition to the acute care we provide in the hospital setting, we also provide psychiatric care, intensive care, and emergency care. And of course, our Gibson Cancer Center is a prime focus of our care, because we're able now to provide cancer care closer to home for all the people in Robeson and surrounding counties. We think that's a big plus from a few years ago when people had to go outside the county for their cancer care. So we're very happy about that. We also offer a good array of fitness services through our Southeastern Lifestyle Fitness Center here in Lumberton. We've also cooperated with Bladen County to offer a fitness center in Elizabethtown. And just recently, we've opened a new fitness center, brand new, in September in Red Springs. So we are able to offer a whole array of fitness and recreational activities through our centers throughout the county. We're very happy about that.
You really have become a regional medical center in that aspect, not only throughout the county, as you said, in communities like Red Springs that are adjacent to Cumberland County or to very close to Sampson County or other counties. The ability for those folks to travel in for not only fitness but healthcare needs, that's a big commitment.
I also like to mention our 5 primary care clinics, our neighborhood medical clinics we call them, and they're in Fairmont, Red Springs, Rowland, Lumberton, and St. Paul's. And that gives the people in those communities an opportunity to have a doctor nearby. And those doctors are also affiliated with the medical center, so if they need care in the hospital, the admission process is very easy.
And we have about a minute, but I understand that the hospital or the medical center, I believe, is celebrating its 50th anniversary. Are there any big plans going on underway to help celebrate the anniversary of the medical center?
Well, I'm glad you brought that up. 2003 is the 50th anniversary of Southeastern Regional Medical Center, and we are going to celebrate that with several things, but our main event next year is going to be the opening of our 136-bed, 6-story patient bed tower.
Golly.
That's also part of our master facility plan, and we're very, very excited about offering 136 rooms, private rooms, large private rooms with private adjoining baths for our patients. The existing rooms now some are very small, some are semi-private, and we know that these new facilities are just going to enhance our ability to give care and to give the privacy that our patients want and need.
Absolutely. Ann Stevens, Director of Public Relations for Southeastern Regional Medical Center, part of the reason why the growth and strength of healthcare providers here in the county have been taken to a new forefront. Ann, thanks so much for being with us this morning.
Thank you, Greg.
Stay tuned for more Carolina People coming up. Good morning. Welcome to Carolina People. Today we're in Lumberton, North Carolina at the Robeson County Fairgrounds. We're focused on healthcare providers in Robeson County, and we're visiting with the Director of the Robeson County Department of Public Health, Bill Smith. Bill, thanks so much for being with us this morning.
Well, thank you for the invitation.
Very definitely. It's a great commitment to see much of what's going on with healthcare in Robeson County. To think all week we've been focused on not only on the Robeson County Fair, but on agriculture here in the county, focused on economic development of the county, and tomorrow we'll be focused on many of the volunteers that really help make the county tick. So healthcare is surely a vital role. Are you a Robeson County native?
No, actually I was born in San Antonio, but went to high school in Fayetteville, and I moved up here in 1988.
Okay. What brought you to Robeson County?
Well, I worked for the South Carolina Department of Health and Environmental Control. Got my master's from UNC Chapel Hill, and was able to put that to work up here in Robeson County.
Have you always been interested in health services?
Right, I've been in public health for 27 years, so actually since college it's the only employment I've had.
So you've been with the Department of Public Health in North Carolina for almost 14 years. In South Carolina prior to that?
A little over 12 years, right?
Golly, so a big commitment. And did you say you had, what had brought you to Myrtle Beach in the first place?
Well, my dad was Air Force, excuse me, so he was at the Air Force Base when it was there as his last assignment. I came back from Vietnam, so that's just the area I stayed in.
Okay. How about your main responsibility with the Department of Public Health here in the county?
Right, well, I'm the director. We have about 225 employees, $11 million budget, primary care, home health, but really what we're here is to protect people's public health.
Are there any main public concerns right now, or any aspects the department's particularly active?
Well, as is the rest of the country, West Nile virus has occupied a lot of time. There's a lot of efforts in bioterrorism, a lot of food handling problems from the contaminant side. Robeson County is unique with the syphilis problem also.
Tell me about that, please.
Well, nationally we rank in the top 15 in number of cases. And you're talking about a county of 125,000, so when you have more cases in Miami or Philadelphia, you're talking about a huge number. Our biggest concern, we've seen the numbers go down this year, but our concern is the lifestyle. If they haven't changed, when syphilis leaves the area, HIV/AIDS usually comes in. So at this rate, we would have tremendous numbers of AIDS in the future if we don't curb the lifestyle that created the problem.
I want to come back to syphilis, but you mentioned a real buzzword, the West Nile virus. When folks these days, probably a lot of viewers know a lot about the West Nile virus. I don't. Could you tell us a little bit about the West Nile virus?
Well, it certainly started in New York City a couple years ago and has now spread to California. So you're talking about a disease that has gone from the East Coast to the West Coast in the space of 3 years. That's unbelievable. And the Carolinas have not been as hard hit. And I think part of it is because we've had the droughts the last couple of years and haven't had the mosquito population. The mosquitoes are the vector for this disease. Crows and blue jays are particularly susceptible to the mosquito bite. They almost automatically die. So if you have crows and blue jays dead in your area, then you know mosquitoes are carrying that disease. North Carolina, 35 of the counties have had positive cases. So we can assume that the disease is throughout the state. We've only had one human case, have not had fatalities. But, you know, the bigger picture, if you look at it, is there are tremendous numbers of birds being killed nationally. Your bald eagles are dying off because they're susceptible. All the raptors are. So over 190 species are dying. You wonder what will happen next year. Will the insect population increase, much like our gnats this year? You know, you just never know.
You really don't. And with 225 folks working with the Department of Health here in the county, they're obviously out throughout the county all times. Are there any activities on a daily basis? How many different departments would be within, or how many aspects of the Department of Health?
Well, we have the home visitation programs, which
Right.
is a tremendous number of people. We also have the environmental, which deal with septic tanks and food and lodging. You also have the clinic services. We do offer full primary care clinics, and we have a home health agency. So there's about 10 or 12 different aspects to it.
Is there much interaction going on with the school systems? Doing training within the school systems, or I know your 225 folks are probably busy as heck all the time. Are they ever able to free up some time to volunteer in the schools, or is that something that's provided by the state to help supplement their incomes to come in to talk to school-age children about things they can do? Syphilis, for instance, you talked about.
Well, we have a full-time syphilis outreach worker who does go into the schools. We do have health educators that work with the teachers. It doesn't do us a whole lot of good to go to a classroom, because then there's another classroom. It's easier to teach the teacher, if you will. And so pass the message on that way. We do have one school-based clinic at Purnell Sweat, which has full medical care as well as the education. So there's no specific money designated for the school interaction, but we certainly work with them.
Speaking of another issue, I remember there was a huge outbreak of E. coli last year. Were there any issues implemented to help protect communities from the spread of E. coli again?
Well, you know, traditionally hamburger is the source of E. coli, but in this case it was actually, in all likelihood, unpasteurized butter. But what that led to was the discovery of a whole host of foods that come into the school. You know, but even if it's a party, people tend to bring things into the school. So working with the school system, we implemented some procedures where you had to have a commercial vendor involved. So, you know, if you had cupcakes, you would go to somebody that has a license. You didn't have to go to Merita, but you could go to somebody that has a license, have them cellophane it, and bring it in. And that helps stop the contamination.
Bill, we've got less than a minute, but I was wondering, as it relates to how the Department of Public Health been affected since the events that happened a little more than a year ago on September 11th?
Well, for the first time, I think we've been recognized as one of the first responders. Traditionally, we've been kind of in the background, but it's really helped us that we've had no infrastructure funding for quite some time. We may get money for a program, but how do you have a health alert network? How do you know what's going on? So the federal government has put a lot of money out towards trying to beef up public health and make them a true responder.
Bill Smith, the Director of the Department of Public Health here in the county, 27 years in public health, an entire life interested in helping others. The big commitment today is getting out, spreading the word, and surely a Director of Public Health like this is enabling that aspect to happen. Bill, thanks so much for being with us this morning.
Thank you for the invitation.
Stay tuned for more Carolina People coming up next. Good morning. Welcome to Carolina People. Today we're in Lumberton, North Carolina, at the Robeson County Fairground. We're focused on healthcare in Robeson County, and we're visiting with the CEO of Healthkeepers, Howard Brooks. Howard, thanks so much for being with us this morning.
Glad to be with you this morning.
It's been a great day, focused on so many aspects of healthcare here in the county. Had Ann Stevens on earlier from the Southeastern Regional Medical Center, talking about so much that's happening in that medical center and how it's affected the county and aspects throughout to really the southeastern North Carolina. Just having had Bill Smith on, the Director of Public Health, and hearing some of the activities that he's been particularly involved in his 12-plus years here in the county. And your activity in the county has been far-reaching. How long are you a Robeson County native, Howard?
I'm a Robeson County native since 1941. Went to school here, elementary, high school, college, and then my pharmacy education later.
You did some education, I understand, in the Palmetto State. You were down in Charleston for a little while.
Yeah, in Charleston for approximately 3.5 years. Wonderful 3.5 years. My wife and I would have probably been there until now if it hadn't been coming back to Robeson County. So it's hard to get away from your roots. So we're back here, and glad we're back here, and providing health services for the community.
All week we've heard about how some of the roots in Robeson County have helped grow the 56th annual Robeson County Fair here to see. I think I saw that Healthkeepers, your organization, is one of the largest fair sponsors and have been very active. What prompted you to become a fair sponsor this year?
Well, it's a way that we can make contact to especially the elderly folks. We understand there's a Senior Citizens Day. We was very active and a participant in that. And I guess from the standpoint of marketing our program, marketing our health services, then also just for the fun, to support something that's beneficial for the total county. That's what we're all about.
Yes, Howard. I understand when you came back from Charleston, you opened a pharmacy. Is that correct?
Yes, we opened a pharmacy in Pembroke back in 1966. It was a very small pharmacy, but it grew, and out of that really grew our health program as it exists today.
that opening of a pharmacy in '66 probably helped set the stage for Health Keepers.
Definitely, because as I say, all the health disciplines that we now have developed actually came out of our pharmacy, realizing that we originally was there just to fill prescriptions, but then begin to seeing a need for services for our customers, our patients, for other things other than prescriptions, namely the personal care activities for the person in the home, for the adult in the home, equipment activities, needs for our patients, and those kind of things that all grew out of the pharmacy.
Mm-hmm. What year was Health Keepers organized?
Health Keepers was first organized in 1994. We've been active and developed quite a bit of growth in the short period of time that we've actually started our activities. Quite a bit of activity.
In recognizing that so many of your patients or so many of the folks visiting the pharmacy needed much more than just filling refills or getting prescription filled or picking up shampoo or other topical lotions. Obviously, that need was recognized in an early age, back in the mid-'60s, and I'm sure it took some time to figure out exactly how you were going to parlay that into a new opportunity. What exactly is Health Keepers on a daily basis? How does it interact with the county?
Well, I'm glad you asked that question, because what Health Keepers again is it's a comprehensive health care delivery for adults, well, all ages, in the home. We coordinate this delivery by our different disciplines that we have, health discipline that we've developed. These health disciplines are pharmacy, home medical equipment, respiratory activities, our personal care activities, and then our skill activities, or what we call acute care activity, and our social work activity. All of this is under the umbrella of Health Keepers. These health disciplines, we strive to integrate them in such a way that to provide a very positive and total wellness outcome for our patients that we serve. Our personal care activity, that activity has to do with older people mostly who have a degenerative process or degenerative disease process which prevent them from doing their daily living activities. And we have what we call a certified nursing assistant who is trained to go in that home to facilitate these needs that this person has. It mainly has to do with their cooking their meal, providing a nourished meal for them, a nutritious meal for them. It has to do with bathing and those kind of things. Then with our skilled activity.
Howard, can I ask you a quick question? If a viewer wanted to learn a little more, we've got less than 30 seconds. If a viewer wanted to learn more about Health Keepers, just a phone number or a contact location.
The phone number would be for 522, or maybe 910-522-0010. That's for our nursing program.
Okay.
Pharmacy program. A person can look up our literature. That a lot of our literature has all our phone numbers on it.
Spectacular. Howard Brooks, the Chief Executive Officer of Health Keepers, a lifelong Robertsonian, someone who's made a commitment of serving the health needs of not only Robertsonians, but folks throughout southeastern North Carolina. Howard, thanks so much for being with us this morning.
Thank you very much.
Stay tuned for more Carolina People coming up next. Thank you for being with us today. We'd like to thank Coble Wilson, Everett Davis, and Morris Billick for giving us the opportunity to spotlight Robeson County.